Have you recently had a hysterectomy or you're about to have one and you're looking for information regarding recovery? Well, bladder problems are very common, but they're not normal after surgery. And keep watching this video if you want to learn how to avoid having urgency, frequency, or even accidents with your bladder after having a hysterectomy. So I want to share with you why is this actually happening and what goes on with your body so you can understand a little bit more about your recovery and actually get some tips to solve this and some things that you can start doing on your own after recovery. So this is your pelvis and your pelvic floor muscles. As a physical therapist, this is something that we are trained to address, are the muscles in your body. And just like all the other muscles in your body, at the bottom part of your pelvis, you have pelvic floor muscles here in red. They're like a basket of muscles that protect your pelvic organs. So after having hysterectomy, if you had a total hysterectomy and you have an abdominal incision, or maybe you had a partial hysterectomy and you just have little portal sites around your abdominal region and you had a laparoscopic surgery. This is still going to be important no matter what type of surgery that you had. But these pelvic muscles, they help support your bladder and they have to function in the right manner. So these are not the only ones. If you were told go do Kegels and squeeze those muscles and tighten and tense them, that is not always the solution for solving bladder problems. And I think it's important to address because many times you'll find online or a doctor will tell you, just go do your Kegel exercises and your bladder problem will get better. Well, these muscles are only a piece of the pie, and actually your brain has to connect with the muscles around your whole core system in order to have a healthy bladder habits, not have the leaking, not have any of those red flags. So it could be your abdominal muscles, your back muscles that are attached to your spine here, your diaphragm, your breathing muscles on the top. That whole system is part of your core and it all has to function together the right way. So in order to normalize your recovery and get your muscles working appropriately, there needs to be some things that you're going to work on and some tips that I'm going to give you right now. Any red flags like having increased urgency, frequency, wanting to go to the bathroom more than every 2 to 3 hours is something that is very treatable, and it's also common after a hysterectomy because these muscles need to function properly. And after a traumatic event like a surgery, your brain needs to learn how to connect to the muscles better. So one of the biggest things that I find is helpful is doing some distraction techniques, and this is going to help with urinary frequency or urgency. And distraction meaning you're going to try 2 tricks to change that firing from your brain connecting to your bladder saying, I gotta go, I gotta go. So the first thing that you're gonna do is just when you get the strong urge to go, you're gonna stop in place and you're gonna take 5 deep breaths. And breaths meaning you're gonna breathe from your belly and your ribs. You're not gonna breathe from up here in your chest. We call this belly breathing or even diaphragmatic breathing. You're using your diaphragm down here. This will cause the pelvic floor to kind of reset and also go back to stabilizing your bladder. So you need to stop and do those slow deep breaths by breathing in through the nose and exhale through the mouth. And with that, you may find by 4 breaths, 5 breaths that you stop feeling that urge that you have to go. The other thing that you can try is distracting your brain by getting that urgency, and instead it will be confused if you start counting backward from 10. So counting backward from 10 is going to flip that signal that's going to your bladder from your brain, and you won't get that feeling anymore. So try those 2 things first if you're getting a lot of urgency or frequency. And urgency and frequency can also be provoked by some things in your diet. So anything that's a bladder irritant that you are drinking a lot of, like even bubbly water like mineral water or tea, coffee, caffeine, any soda, citrus foods, even decaffeinated tea or coffee can do this too. So those are all bladder stimulants, and it's going to send that trigger to your brain again, telling you you have to go. So urge incontinence is this frequency and this feeling like you have to go to the bathroom all the time. Now, the second one is stress incontinence, and this is more of a timing issue that has to do with your muscles and how they are responding and how they're affected by your bladder control. And so if you feel like if you cough or sneeze, you are actually feeling like you're going to have an accident, or you do have an accident, this is also very common after a hysterectomy. Those muscles in any kind of surgery, they just need to be reset, and we need to retrain them again. And so how you're going to do that is you're going to practice some very small contractions with your breathing. And what that looks like, so these muscles in red, your pelvic floor muscles, you're going to imagine inhaling, taking an inhale, and those muscles kind of let go, but you're not pushing them out at all. You're just going to inhale. And then as you exhale, you're going to imagine there's a blueberry right here at the vaginal area. That blueberry, you're squeezing and you're drawing it in and up. So when you do that, you're lifting these muscles like elevator, lifting up. And you can practice this. So inhale, you let go of the muscles, and exhale, you contract and squeeze that blueberry and think of drawing it up. This may get tiring after 3 to 4 reps, but you can do up to 10. Do not squeeze these muscles all the time. We don't like to over tense the pelvic floor muscles because that can create other issues. But when you are recovering from a surgery, it is safe to do this about 7 to 10 days after, or when you get clearance from your doctor and you're not having a lot of pain, or you're not having any bleeding or any other major red flags. You can start contracting and using those muscles and syncing them with your breathing, because this is going to reset and get those muscles to work how they should. So those are 2 tips on how to either solve urge incontinence or stress incontinence. They're 2 different things. Now, if you try these things and they are not helping, I highly recommend you reach out to see a pelvic floor therapist, and they can actually do an assessment and see if those muscles need a further guidance. There's other interventions that can also help this too. You can also go and check out the link that I have for my hysterectomy recovery success program that gets your muscles syncing the right way, talks you through more detail on what I've provided today, and gives you some flexibility and strengthening exercises for your core, so therefore you won't have the bladder problems in the future. So go check that out. Now, thanks so much for watching. Just know this is common to have bladder problems after a hysterectomy, but it's not normal, so we need to solve this. Thanks for watching and have a great day.